In ICD-10 PCS coding, where we will use ICD-10 PCS for inpatient procedures, two root operations most of the coders feels confusing and complicated, which are excision as well as resection. After watching this session, you will be comfortable to code excision as well as resection, which we will learn during this session. Why this topic is very important? So as we have discussed previously, this is one of the most confused PCS concept, as well as most of the coders will code inappropriately and erroneous using this topic, as well as whenever we will use correct root operation, we will get correct reimbursement. If you are visiting for the first time, please click on subscribe button. After watching this session, if you feel this session will be useful for you in your live coding or for your interviews, please click on like button and also share it with your friends. Basically, ICD-10 PCS is based on extent of body part removed, not the disease, okay, and not based on the pathology report, only anatomical removal. So excision and resection are completely based on the part removed, which will be anatomical removal. So what is excision? Excision is equal partial removal. Okay. So cutting out some portion of a body is called as excision. So the rest of the organ remains intact. So here basically patient will remove only part of the diseased organ or portion. Patient will not remove complete organ, and after performing the excision, remaining organ is intact. Most of the time, patient will perform excision for biopsy procedures. So what is the key point you need to remember here? Some part removed is equal to excision. What is this? Some removed is equal to excision. Means whenever documentation contains or if the patient mentions only I have removed part of the disease or part of the tissue, you need to consider it as excision. So now we need to understand what are the tips for excision. So basically what are the keywords you need to check in the documentation while coding the operative reports. So first one is partial removal. So in the operative report, if you see patient mentions partial removal, you need to understand it is excision. Next one is biopsy. If the patient tells biopsy, you need to use excision. If the patient tells lumpectomy, so basically lumpectomy is removal of part of the breast, not complete breast. Complete breast we will call it as mastectomy. But in the documentation if we see lumpectomy, you need to use the excision root operation. Next, polypectomy. So polypectomy is also removal of the tissue of the colon, not the complete excision of the colon. So polypectomy also comes under excision. Next, wedge resection. Most of the time we will see in the lung resections or wedge resection, where patient will remove the part of the lung. Next, segmental removal. So segmental removal also mostly we will see in the breast resection or breast excision, where if the patient is having any type of disease process, patient will perform segmental removal, and otherwise we will call it as segmentectomy. So what are the common examples for excision? Breast lumpectomy, as we have discussed, lumpectomy means removal of part of the breast. Liver biopsy, here patient will take only tissue of the liver, he will not take out the complete liver. Next, excision of skin lesion. Okay, as skin is a large organ, the removal of or excision of skin lesion comes under excision. Partial colectomy, segment only, not complete colon, only part of the colon. Wedge resection of the lung. Next, we will see resection. So basically what is resection? Resection is equal to total removal. So excision is equal to removal of part of the body or organ. So resection is cutting out all of your body part. Okay, nothing of that body part remains. So after performing the resection, you will not see the body part or organ which the physician has removed. So what is the keying logic here? So during the resection process, physician will remove entire body part. Okay. During the resection, physician will not take any biopsy as resection is complete removal of the organ. Most of the time, physician will perform resection for advanced disease process. Okay. So here what is important for you? All removed is called resection. Part removed is called excision. So here now we are learning about resection. So this comes under complete removal of the organ or disease process. Now we will see what are the keywords we need to check in the documentation in order to select resection route operation. So first one is total removal. So total removal means resection, complete excision, again resection, entire organ removed, again resection, total colectomy, resection, total gastrectomy, resection. So what are your keywords here? Total, complete, entire. So in the documentation, if you see these three keywords like total, complete, entire, you need to understand it is resection, not biopsy. So what are the examples for resection? Total colectomy. So here physician will remove complete colon. Next, total nephrectomy. So physician will remove complete kidney. Next, total hysterectomy. So here physician will remove complete uterus. Next, total lobectomy. So most of the time we will see lobectomy in the lungs. So total lobectomy means removal of complete lobe of the lung. Next, complete organ removal. Irrespective of the location, if we see complete organ removal, you can use the resection route operation. So basically this is the side-by-side comparison of excision versus resection. So excision means portion removed. Resection, entire organ removed. Excision can include biopsy. Okay. So resection does not include any type of biopsy. So excision is equal to partial removal of body part. Resection is equal to total removal of body part. These are very simple. So just if you remember these keywords, you can code or you can use excision and resection route operations appropriately. So what are the common coding mistakes? Assigning excision when entire organ removed. Okay. So based on our conversation now, you need to remember if the patient removes the entire organ, you need to code resection, not excision. Assigning resection for biopsy documentation. As we have discussed, we need to use excision for biopsy, not resection. Coding without sufficient clinical detail. If there is no documentation of complete excision or resection, you need to check for query. So what are the golden coding rule here? Pathology removed is equal to or not is equal to body part removed. Okay. So most of the time pathology removed comes under excision. Okay. ICD and PCS follows anatomical extent only, and as usual always you need to check how much of the body part was removed, whether it is part of the body or complete body part. Okay team. So if anyone looking for medical coding jobs in UAE, USA and India, please join in WhatsApp group. Group link is in the description of this video. And also if anyone looking for surgery training, IPDRG training, SCC coding training, CCS certification training, please send WhatsApp message to 707-526-3939. And if you like this session, please click on like button.